Hello friends, I am Dr. Arunkumar. I am a pediatrician and a nutrition specialist. During this COVID-19 pandemic second wave, we are witnessing an extraordinary situation in India. People just going about for beds, vacancy, oxygen, all the vital drugs. So it's really a very difficult situation out there. So, but being a parent, so most of the parents have this question, like amidst this tough situation, how are the implications of this COVID-19 pandemic, the second wave particularly in children? Because in the first wave, I think we have lots of pediatricians, we were telling that COVID-19 pandemic will just present like a simple viral infection in children. Does the same rule apply to the second wave also? Still, are children just safe from COVID-19 or how it is? So we are seeing lots of news daily from the leading dailies, like 1,000 children affected, 1,500 children affected below 10 years, 12 years. So what does this really imply? So that is what we are going to see today. So the first thing one should remember is that when a family gets COVID-19 infection, when the dad, mom or the grandparents or anyone inside the family gets COVID-19 infection, obviously the child is going to get the infection. There is no doubt about that. But previously we were not testing the kids for COVID-19 infection because we were just thinking that okay, it will just settle as a simple viral infection. So that is why we didn't test them particularly. But nowadays, once the parents becomes positive, mostly all the kids in the family are being tested for COVID-19 through RT-PCR, and positive results are being shown, and they are being projected in the media. This much of children are being affected in the second wave. So what does that really imply? So we should understand that COVID-19 infection, even in majority of the adults, in 80% of the adults, it just presents as a simple viral cough, cold and sore throat, something like that. Only in around 15 to 20% of adults, it progresses to the next inflammatory stage where they get lung involvement, pneumonia and all other complications, and sometimes even death. So this is the problem. But luckily, so far, even in the second wave, according to data we get from lots of areas around the country, we see that even in the second wave, even though thousands of children are tested positive in the COVID-19 RT-PCR, a good news is that even though they are tested positive, most of the children do not progress to the hyperinflammatory or the inflammatory stage and the COVID-19 pneumonia like we see in adults. So that is a very good sign. So it is not like adults. So in adults, once the day 5 or day 6, day 7 crosses, we are just very cautious whether it will progress to the next stage. We are very careful and we are very frightened to monitor the progress. But in case of children, almost most of the children, they just develop basic symptoms and they get resolved within 3 to 5 days. But we should not take this for granted. We should know a basic symptomatology. Then we should know what to monitor and when to get some warning signs and when to visit a doctor for any secondary review. So that is what we will discuss today. Most of the children get COVID just like any other viral infection, fever, any cold, that is running nose. There can be some sore throat. Some children get predominantly gastrointestinal symptoms, vomiting and diarrhea. So some studies say 40% of the children get vomiting and diarrhea rather than fever, cough, cold. Then some people can also get conjunctival congestion, that is redness in your eyes. So and some rashes can develop all over the body. So these are the various symptoms that can develop in children. All these symptoms present between around 3 to 5 days. This is what they present like. Most of the children by 4th or 5th day, they should come out of all these symptoms and they should start feeling better. They should have good oral intake, good adequate fluid intake, good urine output, and they should start playing by 4th or 5th day. This is the general symptomatology of COVID-19 infection in children. So when to see a pediatrician? So you should remember that after 5 days, if fever is persisting, after 5 days, if there is new onset of cough, after 5 days, if there is some amount of difficulty in breathing, children may not tell that difficulty in breathing. Sometimes they can get some hurried breathing, that is, they breathe very faster. So if such symptoms are there and the children are not back to their normal playful activity by day 5 or 6, then we should definitely suspect something is going wrong inside the body. So definitely you should go to your pediatrician and get your child tested for some basic investigations to rule out any possible involvement of lungs and other issues. So if such things are not there, children are fine by day 5 or day 6, you can just forget it, just like any other simple viral illness. So will there be any post-COVID recovery symptoms in long term like we see in adults? Generally no. Exception, there is something called MIS-C, that is multi-system inflammatory syndrome in children. What is this MIS-C? It is not exactly a post-COVID complication. Usually after 3 to 4 weeks from recovery from COVID, most of the children actually do not know that they suffered from COVID at all. Only during the presentation we diagnose that they had a past history of COVID infection through some antibody testing, something like that. So any child in such a scenario, when they present with more than 5 days of fever, rashes, generalized edema, that is swelling, then redness in the eyes, some oral changes, some changes in the lips, oral cavity, tongue, etc., and they are not feeling well, they are looking very sick, and the peripheries are cold, and they are having some breathing difficulty. Usually when the doctor checks, the peripheries are cold, circulation is not good, urine output is not good. This is called multi-system inflammatory syndrome, and usually these children, when tested, they will not have RT-PCR positivity. Instead they will have COVID antibodies positive. That means they had suffered from COVID some 3 to 4 weeks back. The treatment is entirely different from managing COVID-19 infection. So we do not give something like remdesivir or something like that. For this multi-system inflammatory disease, usually give something called intravenous immunoglobulin or high dose steroids such as methylprednisolone. Only these can save the child, otherwise the child can get complications including circulatory problems, heart problems, and many other things. So if any child with more than 5 days of fever, we don't know the cause, not subsiding with any drugs, and child is looking very sick, we should definitely consider this MIS-C in mind. But don't worry, this is very rare. Almost in the past 6 months in our town, we have seen, maybe I have seen just around 3 to 4 cases. So maybe other doctors would have seen some 2 to 3 cases, 4 cases, something like that. So it is relatively rare, so no need to worry much about that. So we will move on to the general doubts being asked by many parents. If mom is COVID positive, can they breastfeed a small child, an infant? Definitely can breastfeed. Studies have proven that the COVID-19 virus does not transmit to the child through breastfeed. So definitely can breastfeed. Don't just give the child to someone else and ask them to take care of the child. It is actually harmful to the child. So instead what you can do is do frequent hand washing, use some mask while breastfeeding. That is more than enough to prevent transmission of the infection to child. Otherwise no need to avoid breastfeeding. If parents are COVID, should children be isolated or sent somewhere? It is very illogical and it's a fallacy. Obviously, the child would have exposed to the COVID by the time parents had been diagnosed with COVID-19 infection. There is no logic in sending the child to another home where they are. I have seen cases where parents become positive, they send children to grandparents' home and foolishly, and then grandparents become COVID positive from these kids. Children start playing by day 3, but poor grandparents get sicker by day 4 or day 5. So that is foolish. So don't send them to some other people's houses. You can just take care of one. If the parents are stable and they are just suffering from mild COVID, definitely they can take care of their kids. There is no logic in sending them to somewhere else. If we have grandparents in our home, can we take care of the kids while if the kids or the parents get affected? Definitely the grandparents should be separated from the children, because when adults become positive, they maintain some distance, something like that. But when kids become positive, grandparents think that okay, we should all pamper the child, we should kiss the child and all that, and they get the infection from the children. Children recover in 3 days, but the grandparents get sicker. So please separate grandparents from kids once they have fever or any infection. So how to treat asymptomatic positive? That is, parents are positive, children have no infection, no symptoms, just RT-PCR tested becomes positive. Useless. Don't give anything, don't treat anything, just ignore it. Only if they have symptoms, you can give some basic medications like paracetamol, something like that. Do we need any multivitamin immune boosters as like people advertise to prevent a child from getting COVID? There is no food on earth that has been proven to prevent COVID. So just give the child a good high protein diet and give good amount of vitamins and minerals through good amount of fruits and vegetables. That should be more than enough. No immune booster is necessary for any child. Lastly, steam inhalation recommended for kids? Definitely no. Lots of children are coming with burns injuries. So please don't do such dangerous things to children. No need of anything like that. I hope I have covered most of the queries that are in parents' minds regarding COVID-19 infection in children. So I think it should be more than enough to clear your doubts, and don't panic. It is just like a simple viral infection. Most of the children just manage with confidence, and any doubts you can just ask your local pediatrician and they should be able to help out. Take care. Bye bye. Thank you.